Patients are not coming in anymore so much asking to look like a particular celebrity. They're asking to look like their filtered versions of themselves.
On the show, we see you guys taking patients, and every now and then, I think we've seen Farrah Abraham on the show, some celebrities will pop in. So are there any celebrities that you can think of that you would love to work with?
Celebrities are doing good plastic surgery now. I mean, it's finally gotten to the point where plastic surgeons are not pushing the envelope with celebrities anymore. I don't know why they used to, and why they would always try to do something new to celebrities during the almost the experimental phase of new procedures. But now they're good. What do you think about celebrities? There's no one, that I think hasn't done a wonderful job of their plastic surgery these days, celebrity-wise.
Yeah, I absolutely agree. That's one thing that we're not on the target. And the biggest thing that we also got asked this one question, since you're mentioning about celebrities, in the old days, they would come in, I want my lips like this, I want my nose like this, I want my booty like this. Now, with filters and with, these face tunes and all that, everyone's doing their own type of modification and then asking us. And of course, that leads into the whole scenario that we also talk about, Dr. Dubrow and I, filter dysmorphia. Patients are overdoing it. They don't look like themselves. And especially when they're staring at themselves all the time, doing these Zooms, and especially now, while you're at home, the FaceTime and everything else, that's when patients are really trying to change themselves. And we, of course, get into the point of, let's be natural, maybe doing a little bit, but let's bracket up a few notches.
But just to clarify for one second, what Paul's talking about there is their patients are not coming in anymore so much asking to look like a particular celebrity. They're asking to look like their filtered versions of themselves, so that when people meet them, they don't expect to meet their social media filtered version. They want to look as good as they're making themselves look on social media. So it's not so much celebrity driven plastic surgery, but filter driven plastic surgery.
How realistic would it be to get work done to make yourself look like one of those filters? Is it realistic at all?
Not realistic, because a lot of the patients are coming in, they don't look like themselves at all. They're completely changing themselves, and that's where the unrealistic expectations come in. So our job as plastic surgeons, and also the rest of the community, and being on Botched, is to say, this is not healthy. A little bit of cleaning up your face, maybe a little bit of wrinkles, a little bit of Botox, a little bit of fillers maybe, that's okay. We're good with that. But as long as it's not to the extreme.
But I think Paul's right. There are some filters that we can make people look like in plastic surgery. Those are the filters where wrinkles are removed, or skin is tightened, or there's more definition along the jawline. But and Paul can make people seriously, Paul can make people look, he can alter their nose the way some of the filters can, right? Filters can take sharp edges off the nose, make the tip of the nose look more defined. You can beautifully do that in the operating room. But the ones that basically make you look like a completely unrealistic, blown out version of your own face, those are not achievable. So, my estimation is we can do in the operating room what about 25% of the filters can do, but 75% is not achievable. Wouldn't you agree, Paul?
Absolutely. Well, wait a minute. One thing to add to that. Since we're doing a lot of these reconstructions, we're just trying to get patients to look normal again.
That's
so
right.
We're not even there. And this is in our own private practice too. And this still happens. And we discuss this all the time. Even when we think we hit a home run, someone that comes in with something that is destroyed, they're still not happy when we do a very good job with tissue that has high risk of falling apart. And we deal with that constantly in the back and forth, but that's where patients are unrealistic, or they think that the two of us are at a level where we're going to take something that's been destroyed and make it perfect. That never happens.
Dr. Dubrow mentioned earlier that, you have to tell the patient and, you're upfront with them about what you can do and what is realistic. So how do you, help them make a decision once you give them the proper, information that they need?
So Paul and I have very different styles of interacting with the patients. I tend to use sugar and honey, and I use the sweet approach, and I try to sort of do my own manipulating their expectations by being kind of sweet and humorous. Paul's more straightforward about it, and sometimes can even be very firm. And so sometimes I've noticed that can be extraordinarily effective in setting their expectations. So this season, a couple of patients, I used Paul's technique where I looked them straight in the eye and I go, yeah, no, it's not going to happen. Don't expect it. If you do, we're not going to operate on you. And you need to tell me right now that you don't expect that perfection when you're in this hopeless disaster situation. So it's all about setting expectations. It's all about communication. And it's all about filtering your patients to make sure you know which ones you can achieve their expectations above and beyond what they're telling you. Because sometimes when they come on Botched, they'll tell you anything you want to hear to get on the show because we're their last hope. But even when they tell you that, we know that it's going to, they're not going to be happy at the end of the day.
What can you tell us that fans can expect from the upcoming season of Botched?
This is season 6, part B. We always say this is like the most dramatic rose ceremony yet. Mm-hmm. It was the hardest season, blah, blah, blah. But this season was really particularly unique because of all the seasons, this was the biggest struggle because there's a certain small group of patients that apply for Botched that we always turn down, that are considered just not fixable. Mm. But this season, we decided to take that small percentage and make that the season. So it's basically the season of impossible botch cases that we knew, particularly in my case, that I would have to operate on more than once because I knew I would have complications to get them to the point where they were even in a position to be fixable. And so I always said to them, listen, I'll take you on, but it may take 5 operations. In fact, I could make you significantly worse. Are you willing to go for that? And of course, they all said yes. So that for me is what characterized this season. An enormous struggle. Like we always see the previous seasons were like watching a traffic accident. This is like watching a 10-car pileup.
Some of the movements that have been circulating in the field and in the press, we bring this more to attention, just like and Dr. DeBro deals with that with the breast illness disease, about removing breast implants. And so that's something that now is being more and more brought up about removing implants in season 6. In addition, we have a few topics where it's really hard to discuss in regards to a patient of how they interact with us about body dysmorphic disorder. So we have a few patients with issues like that, and some patients with unrealistic expectations. Because usually we go into, here's the problem, let's fix it, and you're better. Now we're talking about the psychological aspects that we all know about, but we actually show it. And then there'll be some more interesting cases that are highlighted this season that you just haven't seen before on different parts of the body and the face.
If I could just comment on that, rather than 2 cents, I would give that about half a cent. I'm just saying.
Okay.
All right. So you know what I'd like to do to him right now, but I can't, since we're being videotaped, I can't use any rude gestures right now.
Luckily, there's social distancing. Otherwise, there would be social smacking, I
think. You guys are too much. So funny.
I do. I got to tell you, though, I'm glad we're doing this because I miss my buddy. I miss the sarcastic comment. I mean, this is something cute, but this again adds to the dynamics between us. Remember, we're older men. We're not kids anymore, but we still act like we're little punks.
Whoa.
Flexing and being
older men.
Go ahead, just go ahead and show your muscles. That's good.
This is older men.
Okay. Anyway.
Sorry.
Okay, Mr. 60-year-old. But anyway.
Oh, okay.